Childhood asthma, and it's linked to antibiotics. I was asked about this recently. I get asked a lot about different things with asthma, and it's been linked to things like preponderance of allergic stimuli in your environment. It's been linked to difficulty with the birth process. It's been linked to genetics. But one thing's for sure, we see a lot more asthma nowadays than we did before. And so I think it's a good idea to at least ask questions about what some of the triggers are. And one of the things that, so scientists at a Henry Ford Hospital in Detroit, the lead researcher's name was Dr. Christine Johnson. They did a study that basically says that doctors need to be a lot more cautious about how they prescribe drugs, especially to babies who are under 6 months of age. And then again, in this specific circumstance, we're talking about medications such as antibiotics. So just to be clear, an antibiotic is something that you do that you give to kill off a bacteria. So it has nothing to do with a viral infection or a fungal infection, although unfortunately nowadays, there's been a lot of people pushing to have doctors not give as many antibiotics because people are becoming immune to the antibiotics that are being given, and we're creating these super bugs because of the overuse of antibiotics. So what they're showing is, antibiotics, they're designed to kill off harmful bacteria, but at the same time, and most people have heard of this recently, is that they also kill off beneficial bacteria in the gut. So doctors actually believe from this research study that the antibiotic drugs may actually interfere with the development of the gut, and because of that, the immune system. Now, the connection between the gut and the immune system is becoming more well known over the last 15 years. And one of the things that we know is if you don't have a proper amount of good bacteria in your intestinal tract, the chances of your immune system working as well just aren't there. And what they're thinking is that potentially wiping out these good bacteria in a child who's under 6 months of age actually increases their chances of asthma and allergies. And so they went through it. And I mean, the doctor wasn't suggesting that people shouldn't receive antibiotics at all. I mean, if the child's dying of something, they need an antibiotic, they need one. But they're talking about just being more prudent in the prescribing of them for children at such an early age. So what they did was they studied 448 children whose development was tracked for the first 7 years of life. And by the age of 7, the kids who were given at least one antibiotic during the first 6 months were 2.5 times more likely to have developed asthma than those who weren't given the drugs at such a young age. And overall, they were 1.5 times more likely to have developed some form of allergy. So, antibiotic in the first 6 months, 2.5 more times likely to have asthma. Antibiotic in the first 6 months, 1.5 times more likely to have allergies. And kids whose moms had a history of allergies were particularly at risk. Now, some things that they also looked at were particularly interesting, like breastfeeding. Now, people would tend to think that if you breastfeed, automatically your chances of these things are going to go down. And in this research study, that's not what they found. So they found that babies who were breastfed for more than 4 months, and who received antibiotics in the first 6 months of life, were actually 3 times more likely to develop allergies, although they were no more likely to develop asthma. So they were less likely to develop asthma, but more likely to develop allergies if they were breastfed and received the antibiotic. Exposure to pets, so cats and dogs, rabbits, I don't think fish counts as a pet for the purposes of this. Exposure to pets, however, seem to actually have a protective effect. So those given antibiotics who live in a family with fewer than 2 pets, they said fewer than 2 pets or more than 2 pets is how they divided it. So those given antibiotics who lived in a family with fewer than 2 pets were 1.7 times the risk of allergies and 3 times the risk of asthma. But when the family had 2 or more pets, the risks were actually normal. The biggest of all, an 11-fold increase. So here's the 3 things that if you had these, you had a much greater chance of having asthma, were children who were given a broad-based antibiotic like a penicillin, they were breastfed, and they didn't have any pets. Those kids were actually 11 times more likely to develop asthma than any other group. The researchers also found evidence that the more courses of antibiotics a child had, the higher was their rate or risk of developing some type of allergy. So they were correlating not just a one-time use of, but the more they used it, the more at risk they were. And obviously, I mean, this is an interesting study. It obviously shows that further research needs to be done to understand the complexities of it. But I think these are good questions that need to be asked, and an interesting science for me, as a healthcare provider, but also the people who have children who have these things. So